Hello everyone, this is your instructor Dr. Mohsin Saeed. In this lecture I will be talking about the boundary and the contents of the axilla. In fact, we have two lectures to cover the boundary and contents of the axilla. On the first one, on this one, I will be talking mainly about the boundary and I will just mention the contents of the axilla. And on the second lecture, I will be talking in the detail of the contents of the axilla. Okay, so now before get into axilla, there are a few things I want to mention as about the upper limb as a whole. Okay, so one of those is the superficial veins. Now, why superficial vein is important? Superficial veins, they drain the skin and the superficial fascia. And if you look at the cross section of the arm, you can see the skin on the outside, and then you can see some superficial fascia, subcutaneous tissue, and then you have deep fascia, and then underneath there are muscles, and then you can see the bones. So it's a forearm, so you have two bones here. So that is the arrangement: the skin, superficial fascia, deep fascia, muscle, and bones. Okay. Now, if you look carefully in the superficial fascia, excuse me, so you can see a vein here. So this, because it's positioned in the subcutaneous tissue in the superficial fascia, this is a superficial vein. Now, why it is important to know about the superficial veins? Because in this course, you will see when we talk about the deep veins, we don't study the course of a deep vein. Like, for an example, in this area, you will see the big axillary vein, which is a deep vein, but we don't study the course of a deep vein because we study the course of deep artery, or we don't call them a deep artery, we study the course of artery. And if I want to know the course of the axillary vein, I will refer to axillary artery, and then I will say they follow the same course. So that's the reason we study the course of the artery, and when it comes the vein, we say they follow their corresponding arteries. But now superficial veins are special because they don't have any corresponding artery that we can refer to. That's why we need to know the superficial veins of the upper limb. Okay, but we don't go into very detail of it. But in brief, so there are two main superficial veins in the upper limb. They originate in the other side. You can see the palmar surface of the hand. They arise from the dorsal aspect of the hand, from a dorsal venous arch. One lies laterally on the thumb side or the lateral side, which is the cephalic vein, and the other one is in the medial side or ulnar side, which is the basilic vein. Okay, so the basilic vein here and the cephalic vein here. Okay, so and then they are joined together in front of the cubital fossa by a vein that runs obliquely, joining those two veins, the cephalic vein and basilic vein, and this is called the median cubital vein. But remember, this is a cartoon, and if you follow the superficial veins on a cadaver, you may see some variability. Okay, so accept some variability in the pattern of the superficial veins. But you see, if you follow the cephalic vein remains superficial. It goes through the arm and then goes all the way to the shoulder region, where it lies in a triangle between the clavicle, the pectoralis major muscle, and the deltoid muscle. And in this area, it dives deep and pierces the deep fascia and drain into the axillary vein. And again, superficial veins are called superficial vein as long as they are in a superficial position. Once they pierce the deep fascia, then they are not superficial vein anymore. So cephalic vein remains superficial all the way up to the shoulder region, right? Around this area, it will pierce the deep fascia and drain into the axillary vein. Okay, so that is about cephalic vein. Now, if we follow the basilic vein, that arises from the other end of the arch, the venous arch, and then it lies in the medial position. Okay, so you see the medial or ulnar side, the basilic vein, but it doesn't go all the way to the shoulder. You can see around the mid-arm, it dives deep, it pierces the deep fascia around this area, and then it follows it acquires a deep position, and then it follows it goes all the way to the axillary vein. Okay, so that's how the basilic vein ends. So you see the ending is a little different. One goes all the way up, the other one remains superficial only up to the mid or lower arm, and then it pierces the deep fascia and become a deep vein, and it continues upwards, and at the lower border of the teres major muscle, it become an axillary vein. It continues as an axillary vein, which is a deep vein. Okay, so and there are some clinical importance of the median cubital vein, and so some of you may already know that it's the common vein that is used for venipuncture. Okay, so I think that's all you need to know. The superficial vein, as a position, they lie in the superficial fascia. They drain the skin and the superficial fascia. At some point, they pierce the deep fascia and they they drain into a deep vein. So that's what superficial vein will do. And the muscle contraction will help push blood, the venous blood towards the heart. And the backflow in these veins are prevented by the one-way valves, actually, that take the blood towards the heart. Okay, so now another thing that I want to talk to you about is the cutaneous nerves versus dermatomes. These are two different terms, but there are some similarity overlapping, actually. So that's why you need to be very clear what we mean when we say a cutaneous nerve versus what we mean when we say a dermatome. If you look at the definition, a dermatome is a strip of skin supplied by a single spinal cord segment. Now, if you look at this area of the skin, you see the one that I am showing with my pointer. So this is called the C5 dermatome. That's how dermatomal map is formed. So this particular strip of skin is supplied by C5 segment, which means C5 spinal nerve. Okay, so which means the sensory information from this area of the skin entered the spinal cord through C5 segment, only one spinal cord segment, okay, which is C5. Similarly, this area of the skin is supplied by C4, this is by C5, likewise, so T2, T3, T4, like this. So that's how the dermatomal map is formed. The area of the skin, supplied by one particular spinal cord segment. Now, if you look at the cutaneous nerve, you see cutaneous nerve, look at this one. So if we take this one as an example, this particular cutaneous nerve is formed by the contribution from two spinal nerve. One is C5, the other one is C6. This nerve is called superior lateral cutaneous nerve of the arm. Now, you see this area is C5 territory, right? And this area is C6 territory. So now this nerve is formed by a contribution from both C5 and C6. Now, for an example, if you find a patient who lost sensation in this part of the skin, then the things that should come to your mind that looks like this particular cutaneous nerve is damaged or has a problem, which is formed by C5 and C6 segment. And when the sensation is carried by this particular cutaneous nerve, it will enter the spinal cord through two different spinal cord segments, which is C5 and C6. Okay, but if you look at this one, C5, this will enter the spinal cord through one particular spinal cord segment, which is C5. Now you see whole thing is C5. Now you look at this one, this is you will see three cutaneous nerves covering the territory of the C5. Superior lateral cutaneous nerve is this one. This one is carried by inferior lateral cutaneous nerve of the arm. So this is again C5 and C6 territory. And then look at this one. This is lateral cutaneous nerve of the forearm. This is also formed by C5 and C6. So to cover the C5 territory, you need three different cutaneous nerves, but they have overlapping areas. They cover the areas of both C5 and C6. And that's why a dermatomal pattern is not the same as cutaneous innervation pattern. And again, a dermatome may use more than one cutaneous nerve to innervate its territory. Likewise, this one, this is C5 dermatome, and three cutaneous nerves will cover this territory, but it will not do only C5, it will cover some territory of C6 as well. That's why these three nerves, this one, and this one, they are formed by the contribution from two different spinal nerves. Again, the information from this one, this strip of the skin, will enter the spinal cord through this cutaneous nerve through two spinal cord segments, which is C5 and C6, and this dermatome will enter the information from this part of the strip of the skin will be carried into the spinal cord through C5 segments. So there is some difference. So you need to be careful about when you talk about the cutaneous nerve versus dermatomes. And as the course progresses, you will know more about these things. Things will be much more clearer. Now, let's start with the axilla now. So the axilla is a pyramidal, the irregular shape, more like a pyramid, that serve as a passageway for the structures that travel from the neck into the upper limb. Okay, so this is the axilla here. You can see the outline by the green outline, and this area has 4 walls. The axilla is bounded by 4 walls. This is the anterior wall, this is the lateral wall, and you can see the posterior wall here. Okay, and this is the medial wall. I will talk about in detail about those walls. And here you have an inlet, okay, and then you have a base or the floor of the axilla. Okay, again 4 walls: anterior, posterior, lateral, medial. There is an apex and there is a base or the floor. Now let's get detail of those the boundaries. So this is the inlet of the axilla, and this is the inlet of the axilla. Okay, and continuous superior. If you look at this direction, then you are in the neck. Okay, so now if you cross this inlet, now you are in axilla. Now let's see what are the structures that form the boundary of the inlet. Now you can see there are 3 bones here. You are familiar with this one. This is clavicle. To be more specific, it is the posterior aspect of the clavicle that form the anterior boundary. This is the medial boundary formed by the first rib. Okay, medial boundary by the first rib. More specifically, it's a lateral border of the first rib, and then on the posterior part, it is the superior border of the scapula. See, so if this is the superior border of the scapula, this is the acromion, this is the spine of the scapula. We talked about this part, so which means this will be supraspinatus, below this one will be infraspinatus muscle, right? And so this is the superior border of the scapula. So again, superior border of the scapula posteriorly, first rib medially, and anteriorly by the clavicle. So these 3 bony structures that form the inlet or the apex of the scapula, apex of the axilla. Okay. Now let's talk about the anterior wall. Now, if here only skin is removed, and you can see underneath the skin, this is the pectoralis major muscle. Now the pectoralis major muscle, so axilla is here, right? This is the axilla, this is clavicle, so it formed the inlet. So this lateral part of the pectoralis major is a big muscle, right? Now this part, which is the lateral part of the pectoralis major, will contribute in the formation of anterior wall of the axilla. Okay. In addition to that, if you remove the pectoralis major muscle, you come to this image. There are another small muscle underneath the pec major. We call it pectoralis minor muscle. So pectoralis major superficially, deep pectoralis minor muscle, and then also you see a thick connective tissue sheet. We call it clavipectoral fascia that extend from the lower border of the clavicle. It covered the gap between the subclavius muscle and the pectoralis minor muscle, and continues with the floor of the axilla. Okay, so again, anterior wall is formed by, you can see the cut end of the pec major muscle here, pectoralis major, pectoralis minor, and clavipectoral fascia. They form the anterior wall of the axilla. And the inferiormost part of the anterior wall is called the anterior axillary fold. So you see anterior axillary fold is here. Okay, formed mainly by the pectoralis major muscle. Now, in this image, you can see several walls actually. Let's talk about the posterior wall first. You are familiar with this muscle, right? This is the scapula, and you are looking at the anterior aspect of the scapula. So the muscle that is coming from the anterior aspect of the scapula is subscapularis, which is inserted into the lesser tubercle of the humerus. We talked about this muscle before. And then you see these 2 muscles. This one is latissimus dorsi, this one is teres major. So this subscapularis, teres major, and latissimus dorsi, they form the posterior wall of the axilla. Okay. Now look at the attachment of the anterior wall muscle. This is the pectoralis major muscle, which form mainly the anterior wall that is attached to this is the intertubercular sulcus, right? And on the lateral side of the intertubercular sulcus is the muscle that form the anterior wall. On the other side of the intertubercular sulcus is the muscle that form the posterior wall. So both posterior wall and anterior wall converge on the humerus on the two sides of the intertubercular sulcus. That's why intertubercular sulcus of the humerus will form the lateral wall. You can see the lateral wall is bony, and that is formed by this narrow area, which is the intertubercular sulcus. Why we call it intertubercular sulcus? Because this is sulcus located between the greater tubercle of the humerus and the lesser tubercle of the humerus. And you know the tendon of the long head of the biceps brachia muscle will be located in this sulcus. Okay. Anyway, this intertubercular sulcus will form the lateral wall of the axilla. One thing, if you observe this posterior wall, so these are the muscles again of forming the posterior wall of the axilla. This is subscapularis, this is latissimus dorsi, this is teres major. You can see between those muscles there are some gaps. You can remember this one is the quadrangular space, this is the triangular space. So the structures from the axilla, they can exit the axilla through the opening in the posterior wall, like the quadrangular space or triangular space, and they can leave the axilla and reach the posterior scapular region. Okay, so that is something important. And then the medial wall, you can see this is the medial wall of the axilla, and it is formed by the upper thoracic wall. You can see the ribs here. You can see the ribs, and you can see this particular muscle which is attached to the ribs, and it has a typical serrated shape, and that's why this one is called the serratus anterior muscle. So the upper thoracic wall and the serratus anterior muscle, they form the medial wall. So this is the medial wall again, this is the lateral wall, this is the posterior wall, and this is the cut end of the anterior wall muscle. Okay, so we remove the anterior wall muscle to visualize the posterior wall and also the medial wall and also the lateral wall. Okay, so that's about the posterior wall, medial wall, lateral wall, and the anterior wall as well. And again, similarly, we say the lowermost part of the anterior wall will be considered as the anterior axillary fold. Inferiormost part of the posterior wall is called the posterior axillary fold, which is around here. Okay. Now, if you know the boundary of the axilla, it's very easy to look at its content. So this is the apex of the axilla is around here, right? So anything in this area is neck, and anything underneath this one will be considered as axilla. And this is the pectoralis minor muscle, which is part of the anterior wall of the axilla. And this is the subscapularis muscle, which form the posterior wall. So between anterior wall and the posterior wall, this is the lateral wall, right? And which means these are the contents of the axilla, right? Now, if you look at the major contents, you will see an artery here. This is the axillary artery, and in the axilla you will see several of its branches. So when we talk about the contents of the axilla, we say axillary artery and its branches. You can see the big axillary artery with some of its branches, and this is the axillary vein and it's some of its tributaries. So you see, for the arteries, we say they are artery branches. For the vein, we use a little different term. We say they are tributaries of the axillary of the veins. So look at this one. This is the cephalic vein. Around here, it pierces the deep fascia and it drains into the axillary vein. Okay, so axillary vein and its tributaries are also part of the axillary content. And also you can see the yellow structures, these nerves. So these are the nerves of the brachial plexus. We'll talk about in detail about the contents of the axilla, including the brachial plexus. Okay, but remember one thing: they will not be color coded in your cadaver. Okay, so you better be careful. So, but there are in good cadavers, you will see some difference in color between the artery and vein and nerves, but don't expect them to be color coded as yellow, red, and blue. Okay, so. On this, let's look in a different way. This is a parasagittal section of the axilla, right? So look at this bone is scapula, right? This is the anterior aspect of the scapula. This is the posterior. This is the spine, which means this is supraspinatus. This is infraspinatus. We don't need them today. We need this one. So this is subscapularis, that is forming the posterior wall. This is pectoralis major, pectoralis minor, and then you see this thing here, the clavicle here, subclavius muscle here, this white structure that you see here, that is covering the subclavius muscle, covering the gap between the two muscles, and then after covering pec minor, it is going down and march with the floor of the axilla. So this is the clavipectoral fascia. So pec major, pec minor, and clavipectoral fascia forming the anterior wall. Subscapularis mainly from the posterior wall. The apex is around here. The base is around here. So now look at the contents now. So this is the artery, the axillary artery. This is the axillary vein, and these things are the cords of the brachial plexus or brachial plexus nerves, and then these are the lymph nodes. See, so there are a lot of significant lymph nodes in the axilla. We call axillary lymph nodes. Again, if we summarize the content: axillary artery, axillary vein, several brachial plexus nerves, and lot of lymphatic lymph nodes. And in addition to those, you see, look at another structure here. So this is the breast. See, breast is extending all the way to the axilla, right? So this is the axilla. So this extension, lateral extension of the breast tissue, which is called the axillary process because of its presence in the axilla. So it is called the axillary process. So, which means axillary process is another content of the axilla. Let's go back and summarize the contents of the axilla again. We said it's axillary artery here, and axillary vein here, and there will be several nerves. You can see the lymph nodes here. Okay, you can see several axillary lymph nodes. So this is the area of the axilla. All these lymph nodes are axillary lymph nodes. Artery here, vein here, and nerves are not shown in this one. So in addition to these, additional content will be the nerves of the brachial plexus. So I think that's all I have for you in this lecture. In second part of this lecture, I will be talking in detail about the contents, about the contents of the axilla, including axillary artery and the brachial plexus nerve. Thank you for listening. If you have any question regarding this lecture, don't hesitate to contact me or any other human structure faculty. We will be happy to help you out in any way that is preferable to you. Thank you so much.